welcome and introductions. Just a few points about housekeeping. But first of all, welcome to our first virtual and our first joint annual general meeting. We have never held virtual annual general meetings before, so this is going to be interesting. So a few things about housekeeping. The whole meeting will be recorded. So obviously whatever you say will be recorded as well. But then once the transcripts are done, then everything will be erased. The second thing to say is that if you got any questions to ask, then please put it on the conversation section, the chat area, and we will certainly pick those up. If you don't remember to ask your questions now, you can ask any question afterwards, and we will certainly give you the contact number and the email address at the end of the meeting. So before I progress any further, we haven't had any apologies, and I would like to ask other members who would be presenting today, Dr. Lindsay Dickinson, Dennis Jitsi, who is our accountable officer, and Catherine Disley, who is our finance director, to introduce themselves, please.
Hi, thank you, Samantha. I'll introduce myself first. I'm Dr. Lindsay Dickinson. I'm a GP in Chorley, and I'm the chair of Chorley and South Ribble CCG.
Good evening, everybody. My name's Dennis Jitsi. I'm the Chief Accountable Officer for both CCGs.
Good evening. My name's Catherine Disley. I'm the Chief Finance Officer for both CCGs.
Thank you all. Thank you very much. So moving on to the agenda. First of all, we'll have a reflection of how 2020 has gone from all of us, and following which we'll have a financial performance presentation by Catherine Disley, and then we move on to the plans for the future and any questions, and then we close. Now, going on to the minutes of the previous meetings, those have been on the websites for the last 1 year or so, and I would take it that those have been ratified, and I will be signing those off along with Dr. Lindsay Dickinson. So moving on to who we are. Essentially, we are membership organizations of GPs. We plan, arrange and buy a range of health and care services for people who live and work in our local area. There are about 53 GP practices in Chorley and South Ribble and in Preston, and we look after about 400,000 people. So essentially, we commission health and care services for our population. Now, we do closely work together and share an executive team and staff body. And so therefore last year we decided that we really should be having joint meetings rather than separate meetings, and that also reduced our costs as well. And since then we have been holding joint governing body meetings, and this is our first joint AGM. So moving on to our visions and values, they are at the heart of everything we do. We strive to be open and accountable to our patients, their carers and local community, be professional and honest, work in partnership with others to achieve our goals, listen and learn and be willing to change based on what we hear, respect and care for our staff, the people we work with and our local community, protect and invest the public funds that are given to us in a well-managed way. We have a legal duty to make sure that the healthcare services we buy are safe, effective, and of the highest quality, but also these services provide value for money. So moving on to what we do from who we are, we commission various services which include primary care, and we have the delegated responsibility from NHS England. We also provide other services including planned hospital treatment, diagnostic tests, appointments, urgent care, emergency care, mental health services, services for people with learning difficulties, children's health care, maternity, newborn, and a whole host of community health care, which would include specialists and district nurses, speech and language therapy, and rehabilitation. Having said this, the current thinking is to move away from the commissioner-provider split towards more partnership working with various providers and commissioners working together. This will enable better integration of services and also allow more accountability. To this end, an integrated care system has been developed across Lancashire and South Cumbria. And this is supported by 5 local integrated care partnerships, or called ICPs, of which Central Lancashire is one. So Central Lancashire is a combination, or when Chorley, South Ribble and Greater Preston come together, that is a Central Lancashire ICP. And working in partnership, the ICS has now actually developed a draft strategy and a set of priority pathways for improvement to enable the streamlining of care that patients across the whole of Lancashire and South Cumbria receive. Examples being provision of mental health and cancer services. And also add more about partnership working. The Central Lancashire ICP brings together key partners and providers, and these would include GP practices and primary care networks. There are 53 practices, as I said, and 9 primary care providers. There are also other providers, including the Acute Trust, the Lancashire Teaching Hospitals NHS Trust, and we also have the Lancashire and South Cumbria NHS Foundation Trust, which provide mental health and community services, the local authorities, the ambulance service, independent providers, and the third sector providers, which include the voluntary and the faith sector. So moving on to the challenges that we face, we have a growing and aging population, and whilst this is really great news, this does provide challenge in keeping up with providing services with increasingly complex needs. And we also have higher than average conditions such as heart failure, chronic obstructive lung disease, obesity, and depression across both CC populations. Increasing patient need is leading to an increased demand on services and funding that isn't really keeping pace. So we really have to stretch the Central Lancashire Pound as much as possible and make it as effective as possible. And so to overcome these challenges, which I've just mentioned, we have been continuing to work with a range of health and social care partner organizations to join up care and develop solutions that has enabled us to transform the way services are actually delivered. So moving on from here, I would like to hand over to Dr. Dickinson to tell us more about what we have been doing, and more so in relation to the COVID response.
Thank you, Samantha. So just to tell you a little bit about what we've been doing with regard to COVID and our response to COVID over the past few months. Obviously, in March 2020, our healthcare changed dramatically across the country in response to what's been the biggest pandemic facing us for a very long time. And business as usual was very much deprioritised, and the pandemic response has been at the forefront of everything that we've been doing as a CCG over the past few months. The CCG had a major incident response plan, and this was implemented going into what is a command and control structure, very different to the way that we would normally work. In Central Lancashire, this structure was led by the ICS, which is the Integrated Care System across the whole of South Cumbria and Lancashire. The CCGs at Chorley, South Ribble and Preston mobilised resources at pace to really support our NHS partners and also, very importantly, our patients. Our staff here at the CCG have been involved in all levels of managing and supporting the pandemic response across a whole range of organisations. And we couldn't have achieved any of this without the support of our patients, and in particular the voluntary and faith sector, and a lot of generous donations from individuals and local businesses, for whom we want to say a huge thank you. Over the period of time of the pandemic, our CCG workforce has been working remotely. Pretty much since March, a lot of people have been working at home and being supported to do so. Through things like Microsoft Teams and a whole range of other digital platforms, our work has continued. Staff have been supported with lots of wellbeing opportunities and support within the teams to allow them to work safely and securely at home. Our public CCG and GP practice communication channels such as website, social media, text messaging and lots of other services have been developed and providing the latest information and support from what has been a really trusted source and keeping people up to date with what's been going on as quickly as we possibly could. We also, during that time, undertook a workforce skills audit of all of our workforce across the CCG to really try and support our other organisations and determine who within our staff had skills that could support other organisations and therefore be redeployed elsewhere. Within primary care, we assisted with the rollout of digital solutions, which has enabled many practices to be able to continue to work remotely and having staff now in COVID secure environments to be able to work and keep those practices open and functioning. We've supported the provision of hot and cold sites across primary care networks, and this has enabled the safe face-to-face treatment of patients when needed. We also created a PPE, so personal protective equipment distribution line for practices who were unable to source required equipment, and particularly in the initial phase of the pandemic when resources were scarce to get hold of. And our communications team have done an amazing job here at the CCG, sharing initially daily a bulletin with primary care, going through a whole range of national and regional guidance and directives and making that into something that's been really user friendly for primary care to use. And then lastly, thinking about online support for practices with help guides for patients and lots of other really useful information which we've been able to disseminate out to practices to use on their social media and to get that message out to patients about what has been the right thing to do during this time. We've also had a great team of staff supporting our care homes. The regulated care group, which is the group that look after all of our care homes, have provided some oversight of what's been going on in the system and ensured that COVID-19 and our wider safeguarding issues have been identified and supported, including the safe discharge of residents from hospitals. And I'm sure we're all aware of the vast amount of problems there has been in this area in the national media. And we've been really lucky to have such a great team of people here who've really been able to support our local care homes through all of the various challenges that they faced. For care homes, we were also again able to create a PPE distribution line for homes, again where they were unable to source required equipment, and again really supported homes to be able to keep on caring for their residents in a really safe way. We've also provided some staffing support for homes where they were experiencing severe challenges, particularly again at the beginning of the pandemic, but also the longer term support that they've required, again in order to keep those homes open but also safe. And a daily communications bulletin, which again has gone out to the residential homes and our regulated care sector to help them to share the vital information with all of their staff. So briefly, just to talk about hospital services. As I mentioned earlier, our CCG staff to do a skills analysis, and that's allowed a number of our staff to be seconded to the hospital in terms of the integrated discharge team, helping to support patients who are ready to be discharged to be able to go home as soon as possible to the place of care they need to be in. And Central Lancashire wide has had a clinical reference group established, and that's something that I've worked on along with Dr. Jerry Scales, the medical director at Lancashire Teaching Hospitals, to help us to aid clinical decision making and pathway discussions around the pandemic, and allowed us to be really agile and be able to work at pace to make decisions and to change pathways for patients and to again improve the flow of patients through the hospital, but also to try and keep patients safe at home. And then my last slide just for the moment is around PPE and testing. So with regard to personal protective equipment, we've had some significant challenges in the distribution of this equipment to the NHS services. And I'm sure you all have seen in the very early stages of the pandemic that this was in the media all of the time. We've had a team of staff at the CCG who were deployed to sourcing PPE and distributing it to our local services. And we've still got a huge amount of PPE that's regularly going out to practices to support them with this. Testing, again, this has been in the news a huge amount, and the ability to test patients and staff has been a real challenge for all of us right from the start of the pandemic. The CCG has been supporting primary care and care home colleagues to access appropriate routes to testing and to continue to support the public through advice and guidance around this. So I'm going to hand over now to Dennis, who's going to take us through some of our achievements over the past 12 months.
Okay, thank you, Lindsay and Samantha. I've not got that many slides, so I'll be pretty brief. Just starting with my section around our achievements, which is a bit of a strange one for me to start with, bearing in mind the last 6 months and what's been happening across the country. But we have been, working really effectively around improving quality and access ability of our system. And one of the things we've been working on closely is, as you've seen there, basically the wellbeing and health in integrated neighbourhoods. It's a bit of a mouthful. And that is really about connected care, by providing care as close to people's homes as possible. And I would have to say on this one, a great thanks goes to our primary care community, our GP community, and also I'd have to say our local authority colleagues and community services staff as well, who've really sort of come together over the last few months in particular to make sure people are being kept as safe as possible, and where people physically coming into services has not been as easy as it would have normally been, have kept people safe and effectively covered in their own homes, etc. So great thanks goes out to our primary care colleagues in particular. If we could just move next slide, please. So just moving on to the developing primary care networks. This is a big stream of the future of the NHS reforms. It's about practices coming together in bigger units to deliver more integrated care working together. And that means there's different roles for different professionals coming together. So some of the roles planned for the next year, an extension of clinical pharmacists working within general practice, social prescribing link workers, first contact physiotherapists, etc. Lots of different care professionals working together in a more integrated way than we've ever seen before, all organised and structured through the leadership in primary care networks. So that's a really exciting development for us, and we'll continue to do that, and it will be central to the future of health services as we move forward. A little bit on social prescribing. So each primary care network now has a social prescriber link worker in place. They work with voluntary sector organisations, support communities in the individuals, and at regional level, social prescribing groups have been set up so they can transfer learning and create best opportunities for the people they serve. Really interesting development that's going to continue. We've also seen the development of the Haven, which is a mental health facility for anybody 16 plus. And this is a fast track facility, really, that the people who are faced with a mental health requirement or crisis can go straight to this unit, whereas previously they would have been having to navigate through a really quite a complex health system to try and get care they need as quickly as possible. So that's been a really effective service, and we'll continue to build that into the future. Monitoring of patient care, this is a big issue, and I would also have to say that again, over the last 6 months in particular, the way we've, particularly primary care, have been able to monitor patient care using different technologies, using digital technologies, have really risen to the challenge on that. And it was just as well, really, that we've invested heavily in this in the two CCGs. And also, I would have to say that working with our colleagues in other parts of public services, our local acute colleagues and local authorities connecting together and monitoring patient care face to face and also remotely has been a great success for us, and we'll continue to build on that. Just moving the slide forward. Here we go. Keeping you safe. It's obviously a big deal for the health system and for populations, and we have got a statutory duty to make arrangements around safeguarding, promote the welfare of children and young people and adults. And we've got a dedicated expert team within the CCG who leads that on our behalf. Largely sort of in the background, there's no great fanfare about the way they work. But I would have to say, as Chief Officer, I've got a great admiration for that team of people. They really do know what they're talking about, and they do all sorts of really diligent work behind the scenes, working with clinical champions and lots of other professional groups. And they are a very well respected and valuable commodity in the CCGs. Okay, we'll continue to involve as many people as possible. We, as a CCG, it's one of our statutory functions and duties to involve as many people as we can in the delivery and planning of our care services. And we were going to continue to do that as we build forward. We know that there's going to be change to the way the health and public services works in the future, but the involvement of local people is really critical to making that work properly. And we'll continue to develop our methods to involve the public. So I think that's it from me.
Thank you, Dennis. I'm going to spend some time taking you through how we can demonstrate being a well-run, financially sustainable CCG. The areas I'm going to cover are the financial reports, our CCG governance, and our constitution. So in terms of how we spend your money, Chorley, South Ribble and Greater Preston CCG met the financial targets for 2019-20, and they were to achieve operational financial balance, remain within the cash financing limits, and pay 95% of all creditors within 30 days of receiving their invoice. It's fair to say that 2019-20 was a very challenging year financially. As Samantha's already mentioned, our population is growing and it's ageing, and the CCG saw an increased level of demand across all our areas of commission service, which put a real pressure on our financial resources available. Through working with our partners, which includes Lancashire County Council, Lancashire Teaching Hospital and our primary care colleagues, we were able to implement and deliver against a financial recovery mitigations plan, and this enabled us to achieve our key financial targets. Chorley, South Ribble and Greater Preston CCGs were allocated just over £600 million of expenditure from NHS England in order to commission services. The infographic shows the split across the two CCGs and breaks it down further into the specific areas of spend. As you can see, over 50% of our expenditure is around commissioning acute services. And at the opposite end of the scale, 1% of our expenditure is around the supporting running costs for running the CCGs. As the NHS looks to the future, the CCG must make finances work as hard as possible for the local population. The pressures we saw in 2019-20 will remain and at least be continued into the next 5 years. Moving on to CCG governance. Each CCG has a governing body to ensure it has the right arrangements in place to perform its duties, and the governing body leads on setting strategy, approving plans and monitoring performance. In order to ensure our population is appropriately represented, all GP practices are members of either Chorley, South Ribble or Greater Preston CCG. The CCG constitution sets out the responsibility for commissioning care for patients. It is a legal document that outlines the governance structures and responsibilities of the CCGs, and our constitution applies to all our members and employees. So in short, anyone acting on behalf of the CCGs. Each CCG is currently undergoing the annual constitution review. The membership engagement process is currently underway, with voting on any significant changes taking place at the membership councils in October, following which a revised constitution will be submitted to NHS England for approval. I'll now hand back to Dennis, who will take you through our priorities for the future.
Thank you, Catherine. Well, it's got three of us on there, so I'm not sure I'm going to do this, but I'm guessing Samantha and Lindsay will chip in when they see fit. So, priorities for the future. Well, unfortunately, the impact of COVID is not over yet, as we well know. We're all well versed in that. So, phase 3 planning and beyond. So, for those who don't know what phase 3 is, it's about a return the NHS to its normal state as quickly as possible, and we've been working with our partners across Lancashire and South Cumbria to plan for that. It's quite a technical process and it's very important, but we do need to get services back as near to normality as possible while we're still dealing with the tail end of COVID. We can move on. The future of care. Well, I've referenced earlier on digital. I don't know if Lindsay might want to just talk us through the experience of using it in general practice.
I'll talk to you about digital, yes. So digital innovation has been really key in supporting the delivery of NHS services over the last few months in particular. And we've seen some real pace around the ability to get new systems in primary care and across many other organisations as well. So one of the key things at the very beginning of the pandemic was a national directive to think about digital first approach, particularly in primary care. And GP practices have seen a number of developments, particularly thinking around the rollout of Dr. Link, which is a website where you can be triaged essentially to understand where is the best place for you to receive some care for a particular problem. And that might be to book an appointment directly with your GP practice, which you can do through the Dr. Link, or it might be to direct you to a pharmacy or another service that can help and support. Lots of our primary care colleagues are now using video consultation to interact with their patients on a regular basis, whereas previously most appointments would have been done face-to-face. Now the very vast majority have been done by telephone or by video. And so one of the things that we've worked really hard on as a CCG is supporting that with training and supplying equipment as well for video consultations. And I think this is going to be one of the things that will continue to be really supported in the future as primary care changes the way that it works. One of the other innovations through this pandemic has been the introduction of an advice and guidance service. This is a web-based tool that allows GPs and other clinicians in primary care to write a message to a consultant at the hospital and receive a message back in a really fairly timely manner. So usually within 2 or 3 days we can get a response back. And that means that we can think about how we avoid referrals to the hospital, but also how we get specialist advice really quickly to allow us to make decisions about patients' care and being able to manage those patients within primary care rather than having to send them up to the hospital. So of course, we're still offering face-to-face services within primary care, and that continues to be offered where it's appropriate and where it's safe to do so. But we are really seeing the benefits of having access to lots of other services at the touch of the button and being able to sort of use some of these digital innovations for the future. So I'm going to hand over to Samantha, who's going to talk to us about one of the new things that are coming online, which is NHS 111 First.
Thank you, Lindsay. This is something very new, so I would like to give it a bit of time to explain and to describe to yourselves what it is and what it's going to do. So NHS 111 First is part of a national integrated program to improve outcomes and experience of urgent and emergency care. Drawing on our learning from COVID-19 and building on our existing program, our ambition is to improve the offer for patients, delivering improved outcomes and a better experience of care, whether that is by phone or online from NHS 111 or at home from a paramedic in a GP practice or pharmacy, or when necessary in the emergency department. Through changing the way that the urgent and emergency care system is both perceived and accessed by the patient, we will improve services and reduce the risk to patients by minimizing unnecessary healthcare contacts. And this is really to keep patients who are thinking about attending an emergency department safe and allow them to maintain social distancing. They will be asked to contact NHS 111 first. The service will then book them into a time slot in an emergency department or at the most appropriate local service for the patient. However, all patients who need a blue light response will still receive one, and no patient will be turned away if they self-present to an emergency department, but will be provided with the most appropriate form of care, for example, referral to another part of the hospital or another site or assisted use of NHS 111. There will be a phased approach to rolling out the NHS 111, first in the Northwest, starting with 2 first mover sites. One would be at Blackpool Teaching Hospitals NHS Foundation Trust, and the other at Warrington and Halton Hospitals NHS Trust. This will enable all organisations involved to test the process, check its safety, and understand any system impacts and evaluate this service. So NHS 111 First will be more effectively widely introduced across the whole region through the autumn, with a view to being fully in place by the 1st of December, in line with national rollout. But in Central Lancashire, it is due to be launched in November this year. So it's about NHS 111 First. Obviously, this will be something very new to everyone. And we will all need to get used to it, but this will actually provide much better urgent and emergency care when we need it. So moving on, the next thing that we wanted to discuss is about our health, our care, and I would like to invite Dennis to say something about it, being the senior responsible officer for this program.
Thank you, Samantha. Well, 2019-20 has seen us continue progressing the Our Health, Our Care programme. within that period, we've done a number of things. If you think of it as a steps towards a goal, which is to consult with the public, we've taken a number of critical steps, ranging from developing the case for change to engaging the clinical community to look at all sorts of different options, to prepare a pre-consultation case that goes to our regulator, which is NHS England. So that's what we've been working on over 1920. Obviously, because of the current situation over the last few months, in all of us in the health and public services having to contend with the management of the pandemic, the areas around OHOC have had to be suspended temporarily while we deal with that. But we do not see that delay as going into a significant period into next year. So we're constantly working with NHS England to determine how best to complete those steps. Next slide, please. So in terms of looking ahead, we will continue working to develop lots of innovative ways around health and care with our partners in central Lancashire and also wider across the whole of Lancashire and South Cumbria. Samantha and Lindsay have already mentioned that we've got an integrated care partnership established on our patch. That is a really well structured partnership with good relationships across our public sector colleagues. All major partners are included in that, and we continue to develop that, and we will do for the next 12 months. Equally, we are members on part of the integrated care system, which is all of the public services partners and also voluntary services across the whole of Lancashire and South Cumbria. These partnerships have been really effective at enabling us to determine the best way to approach lots of different things over the last 6 months. Things like testing facilities or connecting our acute services together, so we manage the pandemic as one as opposed to individual organisations, enabling primary care to respond and supporting each other. It has been a great effort. So can move us on. Okay, well, that was the last slide.
Dennis, I think just to say thank you very much, everybody, for attending our AGM this evening. I hope you found that presentation really useful and informative. If you do have any questions, I'll be more than happy to try and answer those for you now. If anyone wants to put their hand up, I can see we've got one already, but if you do want to put your hand up, or if you don't feel comfortable to ask it, please just pop something into the chat box. And if not, you're more than welcome to write to us, ring us, or send us an email. And we'll get back to you as soon as we can do. So I'm going to invite Ian Cherry, who has a question.
Thank you very much. It's more of a comment, Lindsay, than a question. To those people who don't know me, I'm the Greater Preston Finance Audit and Conflicts of Interest Board member. I wanted just to say a great thank you to all of our staff and governing body members for the fantastic work this year in extremely challenging circumstances. But more importantly, I wanted to thank the population that we serve, who've embraced the changes we've had to introduce as a consequence of the financial pressures and the COVID virus that we suffered. And they've understood that pressure, and they've continued to cooperate with us in being able to deliver those changes, and I'm grateful for that.
Thank you, Ian, and I think we would all echo your comments and your thank you as well. So thank you for that. Would anybody else like to ask a question or has a comment to make? Nope, I can't see anything coming through. Okay, well, in that case, I'm going to draw the meeting to a close. If anyone does have any further questions that they've not been able to ask tonight, please do, like I say, write to us, email us, or ring, and we'll do our best to get back to you. Otherwise, thank you all very much for your time this evening and for joining us for our AGM. And we'll hopefully see you in person maybe next time around for our AGM in the future. So thank you all very much. Good night.
Thank you all very much. Thank you to our population and staff and